Hi, I'm Dr. Riel Hogseth, founder and director of the Pediatric Dental Team Association. Now, as practicing pediatric dentists, we are always looking for ways that we can make our office unique and at the same time improve our patient experience when they come in for an appointment. Now, real early in my practice, I found occasionally that some of the patients would come in during their restorative appointment, and when we put the nitrous mask on, they would go, "Ooh," or "Yeah, gosh, this is so gross smelling." You know how those teenagers are. But if you've never really smelled the nasal hood in your office, you need to. You can smell the rubber goods, the rubber of the mask, and then when you turn the nitrous on, that's got a really kind of sweet, not pleasant smell. So if there's anything you can do to mask that, it's a great way to enhance their experience, right? So I came up with this great tip, and I'm going to show you a quick segment of our nitrous oxide module on the PDTA website to talk about it a little bit. So first you have your nasal masks, and they come in a couple sizes. So these are the smaller of them, and then the larger. There's also another type that has this configuration, and the newer ones actually have the same little opening at the end. These also come small and large. So we like to use the ones that are the colored and scented nasal masks. Over time, though, these do lose some of their scent, whether you cold sterilize them or if you use new ones each time. We found some scented flavoring at Amazon that you can purchase, and we use the strawberry, bubblegum, and orange flavorings for our masks. And all we do is take a little drop of it, place it on a gauze, and place that gauze then inside the mask. And as it dries, it just keeps that scented. So it really disguises the smell of the nitrous oxide, which is a really sweet kind of smell. It's not too obnoxious, but it's nicer for the kids to have something that they like the smell of. So that's one of the first things we ask them is what flavor do they want to smell today, or what scent do they want to smell. So we give them bubblegum, strawberry, or orange, and they pick from that. So early in the practice, as I said, you could buy scented nasal hoods, and they were orange and strawberry and bubblegum, which worked really, really well for the young children. But I got tired of the cost of that, plus I just like the style of another nasal hood. So I went on Amazon and I searched for both food flavoring oils and fragrance oils like they use for aromatherapy, and you would be amazed at all the different smells that you could get. And they're very inexpensive, so you could really have a vast array of different scents for patients to choose from. Now, there's a couple ways you can handle this in your office. One is that you might go ahead and take some, especially the smaller size nasal hoods that you use for your younger children, and you could go ahead and scent them pre their appointment and just keep them in a baggie that says orange and strawberry and bubblegum or whatever you choose, and keep a bunch of masks in there. And inside each of the nasal hoods, just have a 2x2 that has a little bit of this oil on it, and just stuff it inside the little nasal hood, and it just stays in there and it kind of scents the nasal hood. You do take the 2x2 out when you place the hood. And of course have multiple baggies with the different scents that you have with the nasal hoods in there. Or you could just keep different baggies with the different scents on it on 2x2s and just keep it that way. So you could put 10 whatever 2x2s in there and sprinkle some of the drops of the oils that you're using, and then once you have the patient in the chair and you've got the right size nasal hood out, then you can just take the 2x2 and just wipe inside the depth of the nasal hood. You don't want to do it around the edges because it might irritate around their nose, but just put it up in the depths of it and then throw the wipe away, and they will have that smell that they chose. So if you go on Amazon, you will be amazed at all the different smells and scents that there are. So For the younger kids, we found definitely that the orange and strawberry and bubblegum are all flavors that they know well. Another one you could try is lavender. We know lavender is used for aromatherapy all the time for its calming, sleep-inducing properties. So this is something you might want to keep in a baggie for your a little bit higher anxiety patients. And you might even do a little lavender or maybe another smell on top of it, and you'll get a double dose of a great smell for the kiddos. So if you go online on Amazon, you will see your assortment. And we found that chocolate and vanilla were always very popular. Cookie dough's great. Some of our teenagers like the pina colada or coconut. So there is just an endless supply of the scents that you could use. So you either keep the baggies with the 2x2s already in the nasal hood and keep them separate and zipped up so that they don't dry out, or you can do it in a smaller baggie with just the scents on it and just pull those out when you need them and just wipe the inside, and you will enhance the patient experience as far as the nitrous oxide. This has been your Practice Pearl from the PDTA, and I'll see you on the next one.